Hello everybody, welcome to my YouTube channel, Homeopathy Super Sessions by Dr. Jagos. Today we'll be doing the last part of the part 3 of Robert's chapter 22, that is a disease classification. Hahnemann found out that this form of disease was first made manifest on the skin as a skin infection or eruption, which was his natural place. So we start from the part 3. We have wound out there saying that the chronic diseases would reoccur if some miasm was present, that is, if psora was present. So if psora was present, then this disease would never be eradicated except with the indicated homeopathic simile. So we start from there, we continue further. Hahnemann found out that this form of disease was first made manifest on the skin as a skin infection or eruption, which was the natural place. So the natural place of the psoric miasm was the skin infections or eruptions. However, the natural manifestations are suppressed by many forms of treatment. But however, the natural manifestations are always suppressed by some sort of treatment, such as lotions, ointments, mineral baths, surgical operations with removal of organs. So if you read your organ textbook also, it will tell you, especially in the introduction and later on also, it will tell you that umpteen number of treatments were used to eradicate the eruption on the skin, and it caused nothing but suppression. So even mineral baths were given, whereby the itching subsided, the eruption subsided, but the disease then went more deeper and it ultimately led to the death of the patient. Even surgical operations with the removal of organs is a cause of suppression, like removing the inflamed appendix, removing the enlarged tonsil, drainage of an ischiorectal abscess. All this is a forms of suppression. Or anything that leads to obliterate the manifestation on the surface by seemingly curing the external symptoms, or anything you do so as to obliterate the manifestations of the surface or by the eruptions by seemingly curing the external symptoms. So if you apply some external application on the skin eruptions and you think that you have cured them, then you are totally wrong. You have nothing done. You have caused suppression and you have pushed the disease from the non-important organs to the important organs, from the exterior to the interior. It is on the surface that it naturally thrives, and here it will do the least harm. So the skin eruptions, which is a natural place to stay on the skin or the external surface, it will thrive there and it will cause the least harm. By suppression, this constitutional state becomes more manifest in a train of distressing symptoms. So once suppression occurs, or because of ointments, because of lotions, because of mineral baths, these eruptions, they are vanished or they are mitigated from the skin. Then what happens? Then a trail of constitutional distressing symptoms come up in the individual, as long as the skin manifestation is quiescent. That means what? As long as the skin manifestations have disappeared by the application of the lotion, ointment, or the mineral baths, these distressing symptoms will be found out, will be there in the constitution of the individual and may affect any part of the body. And naturally, it may affect any part of the body, but generally it will affect the vital organs. So by suppression, what are you doing? You are removing the external manifestations wherein the skin eruptions will do the least harm, and you are transferring the disease from a non-important organ into an important organ, from the exterior to the interior of the body. Hahnemann found too that many chronic ailments which were enumerated in pathological works under the distinct names originates, with a few exceptions, in the widely ramified psora. So Hahnemann also found out that in these chronic ailments, there were many pathological works were written down, or they were enumerated with distinct names, and they owe the origin to psora. with the exception of a few, namely skin manifestation and conditions. So everything falls under the condition of SORA, that is the skin manifestation conditions. Almost all adventitious formations, such as swellings of the glands, sarcoma, and carcinomatous tumors. So Hahnemann also classified this under the SORIC classification. Deformed bony structure, hemorrhagic tendencies, all suppurations, function disturbances, and nutrient disturbances, they come under SORA. So you can see Hahnemann had given a very big umbrella under which many names of diseases were coming under the SORA miasm. It is characteristic of the skin in these conditions that there's a considerable itching. For SORIC condition, always itch. So the characteristic symptom of the SORIC miasm will be the itch. Almost all subjective symptoms, especially those described by the patient, sensation as if comes under SORA. So he says all the subjective symptoms will generally come under SORA, especially when the patient describes it as sensation as if. So sensation as if falls under the SORIC miasm, and also all the other subjective symptoms like burning, then smarting, then heat sensation, all these other subjective symptoms also will come under the SORIC manifestation. With respect to the venereal classifications, it has been noted that the action has been swifter and more destructive when the subjective symptoms have been present in degree with SORA, which has been present in the system. So with respect to the venereal classification, the action is much more faster and is much more destructive as compared to SORA, especially when the subjective symptoms have some degree of the SORA miasm present in the system or present in the constitution. So along with the venereal miasm, you also get a tint of SORIC miasm. Then the subjective symptoms will become more persistent and more troublesome to the patient. The fundamental miasms have the period of remission. So all fundamental miasms have the period of remissions. The latent states lasting perhaps for years without showing any manifestation. So the miasm may remain latent for many years without showing any manifestations or the disease expression. So the patient has the miasm which lies in the latent phase or in the quiescent phase on the slumbering stage, but it doesn't express any symptoms. But a sudden crisis in the history of the individual may arouse them to sudden eruptions, and the patient will become severely disturbed in the health. But suddenly there occurs some exciting cause which may trigger the latent state of the SORIC miasm, and it will disturb the health of the patient. So when the latent state of the miasm, where there is no disease being expressed, under favorable environmental conditions, this gets activated and the symptoms again reoccur. These crises may be in the form of accidents, exposure, some slight infection, indiscretions of diet or hygiene, some apparently simple thing out of all proportion to the serious consequences. So what are these crises? Besides the environmental factors, it can be also any accidents, exposure, some slight infection, or some problem in the diet or hygiene of the individual, or some apparently simple thing without all proportion to the serious consequences. Or it may be a small little factor or small little incidents which may not be of a very serious consequence. So these are the different crises which may trigger off the latent miasm. Here, the homeopathic physician, by taking into consideration the SORIC background, will bring into play the remedies that are related in the symptomatology to these SORIC states, and he will be able to do the work most effectively. So here, the homeopathic physician will take into consideration the SORIC background, and he will choose the remedies which are related to these SORIC states. And once he does that, he will be able to work most effectively. So you have to choose a remedy according to the miasm at the background. Then only the remedy will become effective. He realized that this was the dynamic force of the remedy must meet the disease on the dynamic plane. So he realized that whatever dynamic force of the remedy is there, it has to meet the disease on the same plane, that is on the dynamic plane. And that the drug dynamics must be more potent than the disease dynamics if the disease were to be eradicated. So whatever drug dynamics is there, that has to be more potent, or it has to be more stronger than the disease dynamics if you have to eradicate the disease completely. The action of the stigma is to debilitate the life force, to deform the body, to dull the intellect, and to oppress and to upset the reason. So what is the action of the miasm, or what is the action of the stigma? It is naturally to debilitate the life force, or to weaken the life force, to deform different parts in the body, to make the intellect dull, and also to upset the reason of an individual. The miasms are destructive in every way of both the mind and the body, and they tear at every spirit of man. So, furthermore, he says that the miasms are very destructive in every way. That is what it affects both the mind and the body, and even they tear at the very spirit of man, and even they affect the actually the vital force of the man, or the spirit of the man. We must recognize the ancient origin of disease and undertake its extermination on the basis of the miasm. So we must recognize what is the origin of the disease, and based on the miasm, we have to treat it. To classify disease conditions as circumstantial or environmental is to view them in a very limited way. So just to classify the disease, because the disease may be because of an environmental condition or certain circumstantial conditions, this is to have a very limited outlook towards the classification of the disease. We must recognize the background and meet them on the ground if we are to cure. But he says that we must recognize the background. So we must have to identify the background or the root cause of the disease. And then only we will be able to cure the disease. So just by classifying the disease as an environmental, it is because of an environmental cause is not enough. We have to go much more deeper, find out what miasm is responsible in the background for the disease. Then only you will be able to cure. For this reason, it is essential to find out the similimum. So naturally, for this reason, you have to find out the similimum which will correspond to the background, to the miasm, which is at the background of the disease. We must find the remedy for these conditions by seeking a deep-acting remedy, called it antisoric, if you will, to eradicate the evil. So therefore, we have to find the remedy for these conditions by a deep-acting remedy. So a deep-acting remedy has to be found out. You can call it the antisoric remedy, if you will, to eradicate the evil. So if you want to eradicate the evil, we have to find out the similimum. This similimum can be called the antisoric remedy. This antisoric remedy will eradicate the evil. It is only by using the dynamic form of the similimum that we can hope to eradicate the evil. So the medicine has to be dynamized, then only we will be able to eradicate the evil. In fact, only the dynamic form, the similar remedy, can possibly be the similimum. Again, it reminds you that only the dynamic form of the similar remedy can possibly be the similimum. So no matter how like the symptomatology of the remedy to that of the patient, unless the remedy is in dynamic form, it cannot reach the basic stigma. So no matter how well you trace the symptomatology, but if it is not in the dynamic form, you will not be able to penetrate the basic stigma of the miasm and eradicate it. So in order to eradicate the stigma, in order to eradicate the miasm, the medicine has to be in the dynamic form. So that's all in this chapter. So I hope you understood it. It is described in an easy way. and I hope you'll be able to score good in your exams. Thank you very much. If you're new to the channel, please do subscribe to my channel. Thank you so much.